In the Health Hub today, Chief Quality Officer of MetroHealth, Dr. Brook Watts. In a nursing home, is it okay to wear the N95 mask all day, every day? The same mask for 9 days? What if it causes breathing difficulties for workers?
We don't recommend routine use of N95s for people who aren't trained in using them or people who aren't taking direct care of COVID positive patients. So if you work in a nursing home and your supervisors are recommending you wear long-term N95, I would make sure you understood the context. The masks themselves are generally, in general use are meant to be used for 8 hours, but certainly in these times we have seen more prolonged use. But really the question I'd be asking is, what is the indication for using the N95?
How do I know what info is real and what's fake on social media?
I myself am trusting the CDC. I'm trusting our infection prevention leadership in the state of Ohio, and I keep going back to those sites for up-to-date information. You know, I know that our friends on social media, maybe they're trying to keep us safe, but I think really they're trying to get us to click. So I would really caution trusting anything that you see on social media.
When going outside to get fresh air, I was a little leery going out when it was very windy. Can the virus be spread out further through high wind?
We see no indication for people to be worried about getting the virus in this way. This really has to do with droplets. It has to be with being within close contact with someone who's infected. The great outdoors is a wonderful place to be, both for our own mental well-being and to be safe. And just a note on that, it appears that many of the folks in my neighborhood have decided that they want to wear masks while they're walking outside in these very wide open spaces. We really have no reason to think that is something we would recommend at all. Again, the masks are not providing a benefit in those sorts of environments.
Committed to bringing you facts, not fear. Monica Robbins, 3 News.